those wasted hours, will have more time to do some other things that we have not been able to do, right? And then it will also improve the hygiene, people's hygiene, because most of the water that we use are not really protected. They are not really protected. So animals can go into that water. So it's actually so sometimes people suffer waterborne diseases like dysentery, typhoid.
How often do people get those diseases?
Very often. Actually, very often. Most of the time, we are going for treatments. They go there diagnosed with dysentery and typhoid.
You
very common.
You had common cases of typhoid?
Oh yes. Me myself, I have suffered with typhoid actually twice.
Right.
So they are very common. So,
and were you able to trace back to where you got that from? What was the...
Exactly. From the water in the dams. It is not safe. So it is hygiene. But we have not done it. We just have to use it. So what we do now, we encourage people to boil water, drinking water, or to treat.
Do you have enough timber around to boil, to make fires, to boil the water?
Well, yes, we have firewood, yes.
Okay, so you're not short of firewood?
Yeah, we are not short of firewood, yes.
So every time you want to drink, you've got to boil some water?
Yeah, we have firewood, you can boil some water. But it is also sometimes people also just forget, or they don't have time to boil that water. Sometimes you come, you're too thirsty. I mean, you have been burned by the sun, you're coming from the river or looking at the animals. You are already thirsty, you cannot boil water and wait for it to cool.
Sure.
So you just
drink it.
Yeah.
So how do things change when you have rainwater? Because we're just coming into April now, and it's the rainy season about to start. I know the rains are expected to come. How does that change?
Well, it changes things because at least we will have some water, those small dams nearby. It is not really clean, it is not very safe, but it is near. People will not travel long distances to get food. So at least it saves some hours. It will save some people some hours. But it also saves the expense from the other side, because people might also suffer those diseases. So you have to go back to the hospital again for treatment. And treatment for some waterborne diseases like typhoid is very expensive. Right? You
have to pay for it.
Oh yes, definitely. You have to pay for
the government doesn't provide these drugs.
They don't provide it free. You have to pay for it. So it and sometimes now people are starting to buy some small water tanks in their homes. So when you have at least a nice house, you can collect some rainwater.
Yes.
And at least you have some clean water.
So how much does the drugs for typhoid cost?
That it will cost even up to 3,000 shillings.
3,000 shillings, and that's what the price for a good goat?
Yeah, that's a big goat. So that's expensive, because you might need to go to the hospital to buy, so you can try treated for typhoid.
Okay.
Sometimes they treat it when in the first treatment it won't go away, so you have to go back. So sometimes you end up even using up to 10,000 shillings just for treatment.
Okay.
So you see it's expensive. So when it rains, it saves some. Because it saves some hours distance, but it is also sometimes expensive on the other side, because the water is not clean.
So if you could give me a sentence that just summed up how clean, safe drinking water here would change your life, what would you say?
I would say definitely it will change our lives, because it will improve the health of the people. People's health will be. It will also save us wasted hours, and we'll have more time to use it.
Jeremiah, thanks very much.